Really what we've realized in terms of the medical side and on athletic trainers, specifically physios, is it's really not the performance per se, but where we can see the most advantage is in that recovery and really emphasizing that recovery. Now, recovery looks different though for an athlete, an ER doc, because you have scheduled times that don't allow you to recover. And a lot of it is based off of the health system that you work. And so there are a lot of things that you are helpless to, but there are a lot of small choices that you can make even throughout the day that can help improve your recovery. That's something that we focus on a lot is that's different than athletes is we really look at like, okay, let's set that time. You're going to have 2-3 days to recover and that's your recovery time. We can't do that with ER docs. Instead, we are looking at, okay, you have this 5 minutes that you can take. How can we really boost your recovery?
Welcome to Rebel Mind, a new series from Rebel EM, where MIND stands for Mastering Internal Negativity During Difficulty. In this space, we're focused on wellness, productivity, provider performance, and team optimization so you can be the best at home or on shift when making difficult decisions under pressure. At Rebel, we've partnered with Arena Labs, a company which uses a science-backed performance platform to help healthcare workers manage stress and improve their overall well-being. They use data from wearable sensors and feedback to provide valuable insights via personalized coaching through their Arena Strive platform, all to help us as clinicians build resilience and better understand how to manage our own stressors to actually tackle burnout. We were able to take that partnership to the next level and offer a limited availability coaching program that's kicking off on March 3rd. For $999, you'll get one-on-one coaching through the Arena Strive app, including 2 dedicated coaching calls and real-time chat access to your coach. You'll be set up with a wearable sensor and get access to over 200 expert videos and 30 performance tools, specifically designed for navigating the mental and physical stressors of emergency medicine. After the 8-week program, you'll retain access to your wearable data and all content for up to a year. And here's what makes this particularly meaningful. Given the unique demands of emergency medicine, the night shifts, the codes, the constant high-stakes decision-making, this cohort will also contribute to a larger scale anonymous data initiative that we're trying to run, where we're going to showcase physiological realities of emergency medicine in ways that we've never documented before. If you're interested in securing one of these limited spots, head to arenalabs.co/rebel-em-arena-labs- to learn more. So you're probably wondering, what is all this Arena Labs stuff? Well, we recently did a whole episode on Arena Labs origin stories with Brian Ferguson, their founder and CEO. Go back and take a listen to that one to learn more about how it all started and why this is important. Joining me today is Alan Abadi, their principal scientist, and we're going to discuss the science and tools of performance. Specifically, how do you measure what feels unmeasurable? Stress, burnout, and frankly, being fried. And use those measurements to actually change behavior. Alan, it's great to have you on the show, and welcome to Rebel Mind.
It's great to be here.
So you have a particularly interesting role, and your route went from an athletic trainer to nutrition biomarker research, and then to leading performance science at Arena Labs. Tell us more about your background and what problems you were chasing that whole time. I'd love to hear more.
Yeah, it definitely was not a traditional route to get here. I try and think of it as chasing that problem and not chasing a role per se. I was always the kid growing up that asked why. My parents would be telling me something, and then the question of like, okay, well, why do we do that? How far away are we? Asking questions always, it really drove me. I started out as a soccer player. I was very, into the sport, super into athletics. That was a huge part of my identity growing up. Played for one of the top clubs in the nation, continued in college, and that really defined me. But I started thinking about the medical side of things, and that brought me into athletic training. I think a lot of that is similar to what you guys experience as physicians, right? I loved the thrill of being able to reduce a joint dislocation or treat a fracture. And I was really attracted to the acute injuries that athletic trainers experience. As an athletic trainer, I really loved that career. Even though I'm not practicing now, I still, really rely on those clinical experiences for research. And that's exactly what happened. I was an athletic trainer, primarily worked with rugby at the time, and I had a rugby athlete who was diagnosed with a concussion by a visiting athletic trainer. So with rugby, and this was in club athletics for the college level, typically athletic trainers don't travel with them. So I was relying on somebody else to do the diagnosing of the concussion. And this athletic trainer diagnosed a concussion because our player just like hit the ground really hard, grabbed his head. All things that, as an athletic trainer myself, could lead to a concussion diagnosis. It's very difficult in rugby because they get so many of them that they have perfected these self reported tools. And it's really difficult to tell outside of there being a very obvious sign of concussion. If they're throwing up on the sideline, something's going on, we can diagnose them and send them. And so it's a very difficult injury to diagnose. And so no harm or foul on that visiting athletic trainer, but essentially that rugby player came to me and asked me after I was diagnosed with a concussion. I respected that athletic trainer, and I understand that now that starts the graduated return to play protocol, right? Athletes are kept out for an extended period of time, gradually returning back to the same level of play and learning that they normally do. And so he was like, I totally respect that. But why is that the case? I haven't had any symptoms since I hit my head. I hit my head hard, but I never had any symptoms, no dizziness, no headache, didn't black out, any of those things. I feel normal. One of the questions is on a scale of 0 to 100, how close to normal do you feel? And consistently, he's answering 100. But I still have to keep him out for that graduated return to play protocol. And so he's like, why is that the case? In medicine, we practice evidence based medicine. Everything has to be evidence based. I, of course, told him, I was like, well, the evidence says we should do it that way. And he was like, but why? So I dug into the actual evidence, and I was shocked. There was an international consensus statement on concussion. And when you dug into it, it basically said, in the absence of literature and evidence, this is the logical thing to do. That graduated return to play protocol was done because it's logical. We actually don't have any evidence pointing us to do that, but we do it because it makes logical sense and it's not going to harm someone. And so I went back to him and I was like, actually, we have no evidence for this, but this is the global practice. That started a commitment in me to find the evidence and never have to say, I don't know why we do this. So that really started a commitment in me and a question of, is there something that we can do about this concussion problem to define how we recover athletes, but also non-athletes after this injury? And so initially I had started as a nutrition scientist, getting my PhD from University of Alabama, Birmingham, in a search for a treatment. Could we use nutrition to help drive rehabilitation? Can we recover somebody better? And I stumbled upon a biomarker linked to how the body is metabolizing energy substrates after a concussive injury. Any real brain acute injury, the body changes how it metabolizes energy substrates. Essentially, I stumbled upon acetone, which is a ketone byproduct, being a potential marker that we could track over time. We can actually track how the brain is recovering over time by measuring breath acetone. So I was the first person in the world who came up with that, and it was really defined by that clinical experience and a bunch of accidents along the way, right? Trying to research nutraceuticals, maybe having some evidence, maybe not, being present in my metabolism class, and then hearing similar things that I was hearing on the clinical side as well. That parallel universe, I don't think that I could have found breath acetone if I wasn't working as an athletic trainer at the time, and vice versa. So it really led me on this path. I also stumbled upon Arena Labs, loved what they were doing, had obviously experienced burnout myself as an athletic trainer, working 12, 13-hour days. Sometimes we're there until 3 a.m. in the morning, just like working with athletes, things like that. But it's this high consequence environment where if you screw up, right, there are consequences. A lot of times for athletic trainers and physicians, it's death, right? And living in that environment really, and experiencing a lot of what physicians, nurses experience, it really drove me to Arena Labs and the mission that they have to kind of support those individuals. And really at the heart of it is the same question, right? We're trying to find the quantitative solution to a qualitative problem. In my PhD research, that qualitative problem was concussion. And in this research in Arena Labs, it's primarily burnout, stress, these kind of chronic ailments that are experienced by both parties. And so, how do we define that quantitative solution? That's where things get really interesting for Arena Labs. I feel like we're on the cutting edge of technology and how technology can support defining that. But there's still a lot of work to do, and we
Sure.
haven't gotten there. So,
Sure. Yeah, there's so much to unpack here. This is really fascinating and so many things I wanted to touch upon. You talked about understanding the why, and I have noticed in emergency medicine, we are sometimes losing the why in a lot of our diagnoses. We will diagnose somebody with like atrial fibrillation and rapid ventricular response, right? But not
mhm.
understanding as much that the body's response is that irregular heart rate to something else more sinister going on potentially. Or we sometimes will diagnose a patient with congestive heart failure exacerbation, but it's usually like why, or like where did that come from, or what was the trigger that caused the patient to have an exacerbation of either their CHF or their COPD, obstructive pulmonary disease. And so this is fascinating to me because you're taking the why and now applying it in a burnout situation or a stress situation and combining it with the information and the experience from high performing athletes in a similar manner that, some would argue we are high performing athletes. I mean, some say that medicine is the sport, right? And it's a team
Yeah,
sport, of course. And we are in a similar situation and we are sometimes losing the why. And with that, the other tail spinoff that you mentioned was, you looked at the evidence. Obviously, Rebel, we're all about practicing evidence based medicine. For those of you who don't know, Rebel actually stands for Rational Evidence Based Evaluation of the Literature. And so we try to find those whys. One of the most dangerous terms in medicine and statements in medicine is it's because we've always done it this way. And I think that applies to a lot of things and not just medicine, right? In
yeah,
sports, athletes, high performing fields, whenever we have a zone without evidence, the lack of evidence is not evidence, right? It just means you're
right.
operating in a free evidence zone. We often will defer to logical reason, or another big thing that we'll refer to is anecdotal cases or prior situations and cases that have worked in the past, right? And we wait for somebody who is a little bit more organized from the research perspective to compile all of these anecdotes or cases into a study and then be able to look at it on a larger scale and create the evidence for the thing that we are trying to ask. I think it's fascinating too that you're all looking at it from the lens of grouping things together that should be grouped together, like high performing athletes, emergency physicians, etc. And then you're understanding the variables and the differences of each field and how things apply to only athletes and things apply to physicians, military, etc. That's pretty fascinating. I wanted to ask, how similar is what you experienced while doing athletic training and in the high performing athlete world, similar to the data collection parts? It's not like you can just take what works for LeBron James or any of these other athletes and just say to a night shift ER doctor, here you go, do this. How do you kind of bridge that gap of the data measurements?
Very similar principles, but very different execution. While we might be interested in cardiac function in an athlete and also an ER doc, it might change in terms of what we actually measure. And so for us, we typically, are measuring HRV, resting heart rate, things like that, sleep duration, sleep consistency. There's a lot of data out there, but understanding what could move the needle for an EM doc is super important. One of the things that you guys really advocate for, which is something that we do on in terms of Arena Labs, but also managing athletes, is data tracking, right? That is the most powerful thing. If you're not tracking your data, how can you understand how to optimize it or even understand what is success? I think you guys are part of the frontline leaders in taking this clinical work and using data tracking to your advantage. The other things that we typically do that are similar but a little bit different, valuing recovery. We talk about recovery with athletes a lot. And I think that's where you're seeing most of the advantage in athletics coming. We've almost reached the peak performance level in terms of actual execution, right? We think of, athletes like Messi, right? He's
Hmm.
just like pushed the needle so far for soccer, but how do we get better than that? Really, what we've realized in terms of the medical side and on athletic trainers, specifically physios, is it's really not the performance per se, but where we can see the most advantage is in that recovery and really emphasizing that recovery. Now, recovery looks different though for an athlete, an ER doc, because you have scheduled times that don't allow you to recover. And a lot of it is based off of the health system that you work. And so there are a lot of things that you are helpless to, but there are a lot of small choices that you can make even throughout the day that can help improve your recovery. That's
Hmm.
something that we focus on a lot, is that's different than athletes, is we really look at like, okay, let's set that time. You're going to have 2-3 days to recover, and that's your recovery time. We can't do that with ER docs. Instead, we are looking at, okay, you have this 5 minutes that you can take. How can we really boost your recovery? What things can we do when you're active so you don't necessarily have to recover as hard, right? A lot of times, that kind of type A mentality that's with ER docs, cardiothoracic surgeons, you go, go, go until you have nothing left.
Hmm.
Maybe if we could moderate that go, go, go a little bit and kind of tailor that down just a smidge, you won't have to recover as hard and we can kind of decrease that time. There really is a science, particularly in the recovery side of things. And I think people get lost in the performance and the data tracking with performance and lose sight on where that real advantage can come in with
Yeah.
recovery. And that's the same with athletes and ER docs, but it looks very different.
Sure. So you said something that was I like really live by is that measuring your data. One of the things I was told by one of my mentors through my training was that you can't improve without measuring. You have to first be able to measure in order to
Yeah.
improve something. I really took that to heart. I measure a significant amount of my life between my sleep, my exercise, my workouts, pretty much down to my food. And I've noticed that your data that you guys are collecting, when you compare it to some of the commercial wearable companies, is significantly less. And is that because you're trying to focus, or I guess, minimize the noise and unnecessary data, or be able to focus on the recovery component afterwards?
Yeah, it's kind of both. I think what we've seen with these commercial wearable companies is they are trying to expand what they can collect, right? The idea is like the more data, the better. And so they're giving you all of these numbers, and not all of the numbers mean everything, right? And we see that in medicine as well, right? We can run every single test in the book, but there are some tests that just won't remove a differential from that diagnosis. They'll still kind of leave it hanging. That's the same kind of thing we're doing here. We're going to give you the data that you absolutely need. And also, we're giving you data that your coaches within our platform are using to inform how you're doing against your goals. So it really is this biofeedback mechanism. A lot of times with these wearable companies, they'll give you a data point, but not tell you how to change it or how a coach could change it. So, actions and what content you should be doing, what supplements you should be doing. That's something that we're really conscious of. And we understand that ER docs don't have thousands of hours in the day. How can we compress the most important information in terms of biofeedback and content to really improve your life in a short 5-minute period to really improve your trajectory?
Okay, that's great. I'm going to get to content in a second, but I want to ask, because you brought up the videos are less than 5 minutes. Can you elaborate a little bit more about the first pushback that most ER docs are going to give to this? I barely have time to eat on a shift, and I often am staying late 2 hours to get my notes done. How are they supposed to make time for this? How do you feel like we as ER doctors are going to be able to not just make time for this, but also the energy management, the regeneration, the recovery, and the stress regulations you're talking about?
Yeah, I think part of that is a recognition that this is an investment in yourself, right? You do have to set aside time for this and time for improvement. What we're doing is taking all the principles from science and trying to compress that into that 5 minutes to give you the highest chance of improvement because we recognize that your time is valuable. We only include content that's less than 5 minutes for videos because we don't want you making the choice of, okay, I'm not going to work on this tool for sleep, and rather I'm going to work on this tool for hydration because I only have 2 minutes in the day, right? We want it to align with your goals and really help you trend upwards in terms of improvement. The videos themselves, we are bombarded by DIY helpful content, and some of it is from people who are credible. A lot of it, I would say, hot take, the majority of it is from non credible sources, right? I think we
Definitely.
deal with that from patients of them questioning us based off of that, but that is still present here. And so the main thing is we hope that you trust Arena Labs is going to be science backed. If we give you a 5-minute video, there's going to be science behind it. And the videos are actionable, right? We're not just telling you, hey, this is why water's great. Obviously, everybody knows water's great, but we're trying to give you an actual tool of like, hey, here's how you can implement hydration into your crazy schedule and also work with our coaches to find something that works for you. So just because we give you a tool and it's actionable, it's not going to work for everybody. There is that personalized component. And so being able to reach out to your coaches to really modify those actions and practices is where you're going to see the most success. And that's what really differentiates us from all of like the other content providers is that they don't take you into consideration as a clinician, but they also don't specifically take you as a person into consideration. And that's
Mm.
something that we do really good at Arena.
I can definitely attest to some of the tools because I've been part of the program as a part of a trial. On my most recent shift, we had a patient suddenly have a cardiac arrest in the cardiothoracic ICU. They were post op day 4 or 5, already extubated, and it was a witnessed aspiration arrest that we ended up having to open the chest, put on ECMO, and do all of these, really heroic things. And I was actually the ER attending, and I was afforded the ability to assist my colleagues in the CTICU. I found myself doing the shoulder roll when I was on my walk back down from the CTICU to the ER and doing an extended exhale.
Yep.
And I did that because I was like, I'm about to go from literally opening a chest and putting a patient on ECMO to going to see a patient with back pain and going to see a patient who's here for a medication refill. And to go from really, really high to really, really lowering the energy level is not easy. Having the tools to do that made a difference. I use the de-stress breath all the time. I love that breath. These tools and techniques are things you can do in the hospital in real time. That's why I like being able to integrate that into our clinical practice on the day to day.
Yeah. I think that's what makes us different is really considering your unique schedule, the unique demands. They're not similar to an athlete in terms of that high consequence, but physiologically, we're dealing with similar things, and how can we take what we've learned and then implement it in a way that is feasible for clinicians.
Yeah, that makes total sense. You kind of alluded to what the content is like and how the content can help. Is a lot of the science behind it focused on just breath science, or is it pretty broad, different aspects? I know we talked about water earlier. How can you manage the recovery part? It seems like the science is multifaceted so that it can better have a more well rounded toolkit for the clinician. Is that right?
Yeah, absolutely. I mean, we're trying to deal with science that cardiothoracic surgeons maybe haven't touched in their life before. So, on those fringes of science as well, because we try not to give you something that everybody has seen as well. So, there is this level of trying to find the best science and really back up our principles, but also trying to find things that maybe you haven't considered. And maybe you haven't considered it because of a barrier that you've experienced, or maybe it's just something that was left out of curriculum. Nutrition is an aspect of that we hit on a little bit. I think when we talk about where we're going in terms of arena labs in the future, that's definitely going to be a big part of it. I do have a nutrition science
Sure.
background, right? But yeah, nutrition is huge in that. So we really try and capture a full holistic view of the person and the science. So you're going to get aspects of diving into physiologic outcomes. So we're going to look at like breath, we're going to look at sleep, those kind of aspects that cause physiologic change. You are doing something physically. There are other aspects on the platform that are more mental health related. So mindfulness, journaling, reflection, gratitude,
Yeah.
aspects like that. So we try and include both. And I wouldn't say one is better than the other. I would say they all kind of go in together. I would also say you can't have one without the other. And so we really
Absolutely.
view this as a foundation piece. And then in the future, we are planning on expanding to go into more advanced training.
Sure. Yeah. A while ago, I was like, that's all fluff. I don't have time for that. I just got to go, go, go. When you
Yep,
get to a really burnt out space or you get to a critical moment where you're like, wow, if I keep going like this, it's not going to end well, both for my career, but also for my patients. So I need to really reconsider not only my habits, but some of these things that I should probably start doing or at least look into. It's not fluff when you're needing to do it and it's what's keeping you going and actually improving your mental health and mental wellness. It actually is a pretty big game changer if you know how to use it appropriately.
absolutely. And things like journaling, I think as an athlete too, we used to scoff at that and call them like soft skills, right? But that is where you can see the biggest advantage. You think of things like visualization, those are tools in your toolkit that can really elevate you. So journaling doesn't have to be this fluff, getting your emotions down on paper. It really can be an objective measure of where you're at.
Absolutely.
And I think that's where a lot of our clinicians who are skeptical, that's where I think that lands best for them, is to start those kind of reflection, journaling, visualization tools as a way to optimize their performance. This
Yeah.
isn't something that's going to fix a problem. This is something that will bring you to the next level.
Right.
So it's great for a clinician who's burnt out, but it's also great for a clinician who just wants to level up and they're having trouble figuring out how to get to that next level.
Yeah. You mentioned it's like an investment in yourself, right? Kind of like your retirement or finance plan for when you're not going to be able to work or down the road of life. You want to be able to do that, but mentally, and you want to be able to invest in yourself and your own well being as you do a high stress job and job that you might be in a healthcare system that isn't supporting you as much as you'd like. And you want to be able to invest in yourself and take control of your own environment. We work in a place and in a department where oftentimes we have or think we have very little control. The patients come to us, the administrators impose certain metrics, et cetera, et cetera, et cetera. We are just given a shift, given our schedule, but it's like we actually have a lot more control than we think, and we actually can make a lot of different choices for ourselves than we think. So I think that's super important to keep in mind. You mentioned nutrition being a direction Arena Labs is heading to in the future. Is there any other topics or content that Arena Labs is going to focus on with their next research, and what do we have to look forward to?
I think a thread to pull kind of throughout of what we're looking at going towards is personalization in general. That is where medicine in itself is going, right? And so we're also trying to follow that trend, but take it one step further. We're looking at personalization in terms of you as a person and how you interact in the world and where you are at in terms of the spectrum of expert, novice on some of these tools, and how do we get you to that next level, and what is that next level for you specifically, because
Mhm.
you can throw some arbitrary goal out there or level to hit, and it's not going to be the right one for everybody. It's not going to motivate people the right way. So figuring out what is that next optimization level for you as a person, and then personalizing the journey around that. We
Mhm.
also think about it in terms of clinically how you interact with others, the impact of others on you, and then also, how you impact others. And so the interpersonal dynamics is something that we're really interested in. And how does that impact how we should guide you through a learning journey? How does that impact you in terms of reaching your goals? We see that a lot in our coaching discussions. Clinicians get to a certain level, and then there's a barrier, either the health system feeling helpless in that, or it could be a barrier in their partner. Right? Maybe
Mhm.
their partner works a different shift, causing problems because of the different sounds and light needed to kind of function at a home. And so those interpersonal dynamics for partner relationships, and then also like in the workplace, can really impact your journey. And so really understanding that and how it impacts your physiologic metrics, your psychologic metrics, and how we can coach and guide you to optimize in a world where you do have some control over. And so how can we help you make those little choices and have a huge return on investment?
Yeah, absolutely. That's awesome. I want to wrap up and be cognizant of time. I think this is a huge initiative and something that really ER providers should take advantage of. And so I just want to reiterate that this is a program that's going to be launched on March 3rd, and it's going to be dedicated only for emergency medicine physicians. And we're going to be creating our own kind of cohort of individuals who can contribute to this data and better understand ourselves and what we are experiencing through a shift so that we can then improve our recovery and be able to better care for others. Alan, thank you so much for joining me on this. I think it is a very different perspective and much appreciated because we often don't get this kind of perspective from non-medicine folks, but we can definitely learn a lot from other specialties and certainly high performing athletes and other industries that do some similar stress like jobs.
Absolutely. Thank you for having me.
Of course. That's it for this episode of Rebel Mind. Subscribe, share, and stay tuned as we dive deeper into practical ways to care for ourselves so we can show up for others. Take care.